Well, thank you all again so much for joining us today. It's really exciting to have these wonderful guests to kind of talk through the amazing work that they've done. For the past several months, Julia Raifman, Assistant Professor of Health Law, Policy, and Management at Boston University, has been leading an effort to collect emergency orders from across the country to better understand and track how agencies and states are responding to COVID-19. The project, titled COVID-19 U.S. State Policy Database, CUSP, has produced a really, truly fantastic resource I'm excited for her to share more about. Before we do introductions, I just want to thank you all for joining us. We'll be posting related resources to this webinar momentarily on muckrock.com, including links to relevant resources, example requests, and ways to subscribe for future updates to this project. I also just want to thank the sponsors for this training, the John S. Knight Journalism Fellow at Stanford, which is supporting the COVID Public Info Project, which this is part of. Julia Raifman conducts research on health and social policy drivers of population health and health inequities. Dr. Raifman focuses her work on mental health and infectious diseases. Examples of her research include analysis of the relationship between LGBT rights and mental health, of the association between state firearms policies and suicide, and on disparities in risk of severe illness due to COVID by race and income group. Dr. Raifman's research has been covered in the New York Times, The Guardian, National Public Radio, and The Advocate. Dr. Raifman teaches quantitative methods for health services and policy research. She enjoys mentoring and is committed to promoting the success of diverse students. Dr. Raifman received her doctoral master's degree from the Harvard T.H. Chan School of Public Health and completed a postdoctoral fellowship at Johns Hopkins prior to joining Boston University. Also joining us from CUSP is Kristen Nocka. Kristen is a research fellow at Boston University School of Public Health and Division of Health Law, Policy, and Management. She works on projects related to disparities in HIV prevention and variation in state policies related to COVID-19. She received a master's in public health from Boston University's School of Public Health with a focus in epidemiology, biostatistics, and infectious diseases. And then today's moderator, Garance Burke, is a global investigative journalist with the Associated Press on leave at Stanford University this year as a John S. Knight Journalism Human-Centered Artificial Intelligence Fellow. Her current research focuses on the major role algorithms play in government decision-making, especially now amid the global health pandemic. Burke's work with the COVID Public Info Project is examining, among other issues, how predictive tools are being used to determine who qualifies for unemployment benefits or early release from prison due to COVID-19, as well as how facial recognition is being used in new areas far from the public eye. Often driven by exclusive data analysis, Burke's previous investigations have prompted federal investigations, congressional hearings, and cabinet-level resignations. A 2019 Pulitzer Prize finalist, she led AP's first partnership with Frontline, a documentary film based on her reporting about the treatment of migrant children on the US-Mexico border. Based in San Francisco, she is a graduate of the University of California's Goldman School of Public Policy and Graduate School of Journalism, where she has also taught data journalism. She began her career in Mexico City, where she was a staff writer for Mexico's financial daily, El Financiero, and the Washington Post. Garance, please take it away.
Thanks so much, Michael. Sorry for the delay there. Julia and Kristen, it's a real pleasure to have you here with us today. We're so honored that you could make the time amid everything to talk about this really remarkable resource for accountability reporting now at a time when we're really starting to see what a difference state policy makes in terms of both public health outcomes, who qualifies for unemployment, and so many other just incredibly important issues that are affecting all of our communities. So Dr. Raifman, I just wanted to start out by asking you if you could tell us a bit more about how this project started. I was really interested to hear when we were speaking previously that you'd done some work on the relationship between policy changes at a state level and HIV and mental health in the past. Obviously, another huge public health issue that was experienced differently by folks in different states. So how did you draw on that knowledge to look at different state policy responses now in the times of COVID?
First of all, thank you so much for hosting us today. It's really wonderful to get to engage in this conversation and share our database. I'm happy to share. So as you mentioned, I have conducted research on policy analyses looking at how changes in policies have affected mental health and HIV. And so I know from that prior work that it's really important to have data on the dates of policy changes. And I also know from that work and from my teaching that the data that we have available to us, easily accessible to use, really informs the questions that we ask, whether that's as researchers or as journalists or as the public. And so when COVID was hitting, I thought, what is the most useful contribution I can make? It's to start providing these data so that not only our team can use them, but we can facilitate rapid research and journalism and public questions broadly. And so Kristen and I started putting together a database of dates. And then one of my colleagues mentioned that he had students who were eager to contribute to COVID response as well. And we reached out to the students on his listserv, and we heard back from 30 student volunteers. And so that is how this database came to be. It's really a collaborative effort, thanks to so many students who are volunteering their time. Kristen Nocka, my research fellow, who's just done an absolutely fantastic job standing it up and developing rigorous processes for collecting and validating the data. And that is how we have built what we have so far. And we are continuously updating the database. We include both health and social policies. A lot of my work has shown that we may think of health policies as driving health primarily, but we see that social policies play a really important role in driving health. And I think that's as true now as ever, that as so many people become unemployed, we're seeing really a disproportionate burden on the mental health of people who are low income, who've lost their jobs. And I think that's really going to affect their well-being, their food security, their housing security, and that is going to shape health in maybe even just as much as COVID and as much as health policies in the months and years to come. And so we collect data with a real focus on populations disproportionately affected by COVID and its economic ramifications.
Thank you. And I wonder, just to orient some of the attendees, reporters, researchers who are on the call today, if you can give us a brief overview of what data resources the project contains, and also how you've sourced all of these different state policy responses at a time when things are changing so rapidly. We're having closures and reopenings and second closures, and it all seems to vary so much by locality.
Yeah, absolutely. So it might be easiest for me to actually just share my screen. So let me see if I can do that easily. All right, can you all see it? Okay, great. So this is our homepage on our Google Sheet. If you go to tinyurl.com/state policies, maybe somebody can drop that in the chat box. But if you go there, then you will see our landing page, and you can see the list of, we have 87 policies that we've collected at this point, and they include state of emergency, physical distancing closures, stay-at-home orders, reopenings, second closures, face masks. I will highlight that we have a little bit more detail on face masks than a lot of other databases beyond just whether there's a mandate or not. Quarantines for out-of-state visitors. This is another area where I haven't seen a lot of other data, is alcohol and firearms during the pandemic. We have seen increases in alcohol use. Housing and evictions, as well as utility shutoffs. Unemployment programs. I think this is an area where our database is also really unique. Certainly there are Department of Labor websites where you can find some of this information, but I think we've pulled together a lot more data on unemployment insurance during the pandemic by state, and things, detailed information on things like whether people are covered for childcare, if they needed to leave their work so they could take care of a child who was out of school suddenly. And whether states have waived their 1-week waiting periods, that kind of thing. Food security. So here we have SNAP, and we're adding WIC as well. Healthcare delivery, racial disparity. Here I'll highlight that we have unusual data on abortions, and we have a mix of telehealth policies and health insurance policies. Racial disparities, we have recorded whether states are reporting testing, case, hospitalization, and death data, and the month when they began reporting that. Policies for people who are incarcerated and to try to protect them. Substance use disorder policies, and the delivery of medication-assisted treatment, in particular to people who have substance use disorders. And then a couple of pre-COVID policies that we thought were important, paid sick leave and Medicaid expansion, as well as several state characteristics. And we are continuously expanding this. So a lot of times we're breaking down policies that we think are important into smaller subsets. So for instance, one of the planned breakdowns that we have is to look at those utility freezes and break it down by utility type, like water or electricity. We're focusing a lot on unemployment programs, is doing a lot to shape well-being right now, and of course, healthcare delivery as well. And we also welcome suggestions. So if you come across policies that you think are really important at the state level, then we're glad to add those to our list. And you asked about the way that we collect these data. So it really helped us, I think, that we were doing it in real time. We started really early on in the pandemic, and so we could see news coverage of the policies that were coming out right then. And then we always try to source it back to an executive order. But that has been important, as sometimes government websites have changed over time. So with something like physical distancing closures, we can usually capture it through an executive order. But sometimes with schools, we had to find it on the school webpage. And in that case, we would take a screenshot of it. We also make publicly available our source data. So that's tinyurl.com/state policy sources. And that's in a Dropbox folder. You can see we also have a GitHub, so that's linked here. And all of this information is available here. Here you go. So here's state policy sources. All this information is available on this landing page. As well as I will highlight our really fantastic list of volunteers, contributors here at the bottom of the page. So we try to source everything back to an executive order. Sometimes it's a tweet. I'm sure you've seen that. Sometimes it's a tweet from a governor. Sometimes it's a screenshot of a Department of Labor page for a state indicating that they have waived the 1-week waiting period. But whenever possible, we try to link it to actual source documents. And then our process for entering the data is we typically have students search the government websites for executive orders and directives. So sometimes it may be a directive that comes from a public health official rather than a governor. The team does not find a policy. I think the zeros are one of the most challenging aspects to verify. So then we look around to see if we can find any media coverage of a policy and try to trace that back to government documentation. We have double entry by 2 team members for every policy source. And then whenever we can, and this is something we continuously do over time, we compare the data we have collected to a complementary data source. So I saw someone asked about contract tracers, and we have not found a specific policy on contract tracing to add to the database yet, but if you have suggestions, then we would welcome that. But I have seen that Kaiser Family Foundation, they're one of the leading websites that we go to. They collect their data and report their data differently. They usually report it as a binary variable of whether that policy is active currently. And so we will try to validate the data that we have against a source like the Kaiser Family Foundation The Commonwealth Fund has data that we compare to. The University of Washington has physical distancing data that we compare to. There are fantastic websites with lists of executive orders, but so far we haven't found anything that is exactly like what we have. Here, I'll just show you the format of our data for something like physical distancing closures. So here we have the state name, abbreviation, and FIPS codes, and then we have the actual date when states took several steps. Here we have the same thing for stay-at-home orders. And then we sometimes have binary notes about the policies. So we saw that religious exemptions were becoming a thing in several states, so we tracked that as a binary variable. Here are opening dates. Oh, sorry, did you have a question?
Oh, sure. No, I just wanted to highlight for those on the call just how valuable this data source is because of the level of fact checking that has gone into compiling each of these tabs, and also to highlight that the primary source documentation is available here. So if you're on deadline and want to cite this information, you have the primary source document that you can go to right in the tinyurl.com/state policy sources link that's available on the first page. Because I think for journalists, working against such tight timelines, it's always important to be able to refer back to the original source documentation. One other thing I just wanted to talk with you about, Dr. Raifman, is I see a real through line here for journalists in particular in scrutinizing the policy as it's stated, as it should be performing, and the enforcement or lack thereof in each state. So sort of the ability to ground truth, some of what you found, I think is a real, area to explore for journalistic inquiry, because it could be, as we're looking at this tab on face masks, that there's a mandate that's enforced by fines, but there's unique opportunities for journalists to figure out if that's actually happening, right? So this is sort of a trail of breadcrumbs that can lead you to a lot of creative story ideas. So I did want to ask, as you've been compiling this, we were also talking a bit about, who's responsible ultimately for carrying out these policies, as well as who is harmed as a result, and the possibilities for disparate harm. So I wanted to just at a 10,000 foot level ask you if you can comment a bit about some of the differences that have really stood out to you with some of these policies from locality to locality. Because I think that's another rich area for journalistic inquiries, to compare your state to others and see how much of an outlier your community may be from others across the country. So I just wondered if there are any particular topic areas where you've seen that really sort of broad set of differences come in.
Yeah, absolutely. So I think that your question brings up 3 points. So one is about mandates versus guidance. So that's something we've seen since the beginning, and it may sound sort of like old news at this point, but we still don't have good evidence on whether mandates versus guidance differentially affect things like whether people are wearing masks. And so I've been surprised by some states providing just guidance and not mandates, and I think that's an important question to investigate. I think another state that has, another fact that has really surprised me is that California has really been leaving most things to local control. And so I think that's an interesting question to investigate, is how is that affecting their COVID response and COVID cases and deaths. And then the third point that comes up, which really is actually the reason that we initially added the fines and the face masks, is that, and whether they are enforced, is that I think that there are new issues arising, well, old and new issues arising in terms of racial disparities in how people are policed. And so I think that we saw from New York from the early days that social distancing, physical distancing policies were enforced for a lot more Black people than for white people, and that people had really different interactions with police. I think we've also seen a lot of videos of physical altercations with police and with just interpersonal physical altercations. And I think what I've seen from the mental health data is it's a time of just profound anxiety across society. So I really worry about the interaction of anxiety, policing, and how that will disproportionately affect people of color who are already disproportionately affected by the pandemic as well, and by unemployment in the wake of the pandemic.
Yeah, absolutely. And I'm wondering, I know you have this tab specifically looking at racial disparities, but do you have suggestions for participants who may want to link some of the data in other tabs, say around unemployment insurance or housing, to stories dealing with racial disparities in either of those subjects as well? Are there other outside data sources that you would recommend folks mash up the data you have collected here with to find additional insights into how this pandemic is affecting communities of color?
Yeah, that's an excellent question. And I think one of the most powerful aspects of this database is, or one of the ways this database can be most powerful is by linking it with other databases. And I would really encourage you to think about data, not just on COVID, but also on homelessness, evictions, food insecurity, as well as COVID cases and deaths. This website, Understanding America Study, they have nationally representative data from 8,500 panel members on a whole wide variety of questions on their life situation and their experience in the wake of COVID. So they've made their data publicly available for download. You just have to register for their website and write in 2 to 3 sentences about how you're using the data. But I think I would encourage you to link to data sets like this, data from the Department of Labor on unemployment by state and by race, and on claims, whether people are actually getting paid unemployment insurance, and who is and isn't. I think is there barriers to unemployment insurance? Are there people who are disproportionately affected by those barriers to unemployment? Can we pick up on that by looking at the data? And there are just more questions than any one researcher or journalist can answer. So I think these are really important questions to be asking, and that we hope our database can facilitate. I would also say that sometimes it doesn't make sense to link to data at the level of the state. Sometimes it will, but sometimes it may make sense to say, well, how are these state policies affecting what's happening in cities where COVID transmission has really happened most quickly, especially up front? How is it affecting what's happening in Native American reservations? Things that are happening at the state level. Are they affecting spread in communities that are disproportionately affected by COVID? And I think always, actually, this is something we've seen in some of our own research. We have a working paper out on how shelter-in-place policies affected people who were lower income less because they were still required to go to work as essential workers, is our hypothesis. But I would always encourage breaking down by subgroups. It may be that some policies are really beneficial for some people and not for others. And so looking at racial disparities in how policies are affecting people, income disparities. And sometimes that's possible on an individual level with data like the Understanding America Study data. With something like the New York Times data, you can link the data by county to the makeup of the county, and how many people are below the proportion of people who live below the federal poverty line, or the proportion of people who are Black, that kind of thing. I see that there are several questions here. I'll let you I'll let you decide when to incorporate those, but I'm just taking a peek at them.
Sure, no, this is great. And please keep the questions coming. We'll break to do questions from participants in just a few minutes.
Great.
I did want to say that we, as part of the COVID Public Info Project, will also be circulating a list of resources of other data sets that you can use in conjunction with Dr. Raifman's site here, including COVID racial tracker data. ProPublica has some great data tracking PPP loans, which could be interesting to look at in terms of who's benefiting from government recovery funds, you know, and what unemployment looks like in those particular areas, or other kinds of ways of scrutinizing economic disparities, as well as some of the Zillow quarterly releases of foreclosure data, which provides another way to look at you know, how the population is faring in particular localities, as well as you know, looking at public health outcomes and the ongoing economic crisis. I did have one other question for you, Julia, which is, you know, often something we think about in a forward-looking sense as journalists. What has not been covered as yet? And I know you're always adding to the spreadsheet, but what are some of the data categories that are growing that you're most interested in looking ahead?
Yeah, I definitely think the, I'm going to go back to sharing my screen. I definitely think that the unemployment data that we've collected would be a really great topic to investigate further. It's also, you know, a big policy question right now, right? Like, will the federal government expand supplemental unemployment insurance payments for people who are receiving unemployment insurance past July? So I think this is a really important question to investigate right now and potentially inform federal policy decisions. And I think, you know, I think there are some data out there speaking to the fact that that a lot of people haven't received unemployment insurance benefits yet, that that's been slow in several states. And what I can see from the data that I've started investigating in the Understanding America study data is that people who are in low-income households who have lost their jobs are experiencing really high levels of food insecurity. You know, we've seen some good coverage of the coming wave of evictions, but you know, I think if there's journalism showing, you know, what's happening in the states that have maintained eviction freezes, and can we quantify the number of people that that's helping, the number of people who are vulnerable, who could be helped by that kind of policy. You know, I think that's really important journalism to do right now.
Great. Well, let's transition into some of the questions that are coming in from participants here. Michael, do you want to select some of those that have been posted?
Yeah, that'd be great. So I think we had, let me also, we'll take this part of the session off the record. So if there are some reporters here working on stories, so we just ask that you use this knowledge however it's most helpful, but please don't steal each other's stories or out people for asking questions. So we just pause to close out. But there's one more question. Great. Thank you again so much, everybody, for joining us today, and thank you especially to our speakers and our moderator. It was really a wonderful discussion, and we really do appreciate it. There should be a link that'll pop up with the links to the various resources mentioned here today. I'm going to go through my notes and try to capture anything I missed, but feel free to reach out if you have any follow-up questions. We also have a few example public records requests that kind of help ground truth some of the data that come up, so feel free to kind of tweak and reuse those with your own local government. And we're looking forward to continuing on with these series and really benefiting from the amazing work that CUSP has done so far and will continue to do. So thank you all so much for joining us, and take care.
Thank you for the opportunity, and thank you all for your great questions.
Thanks so much for being with us today.